Hey there, therapists. I've got a really fantastic interview lined up for you today and something that's really important at the moment. I've got Anne Williams, and she's coming on to speak about the current pandemic, about COVID, and how as massage therapists, how can we get back to work? When can we get back to work? And when we do, what will it actually look like? What are the things we need to put in place so that we can remain safe and so can our clients and our communities? Now, Anne is an absolutely amazing woman. I really enjoyed this interview with her. She's been a therapist herself for 23 years, and she's also been a teacher of massage in that time. And she's worked for ABMP as actually the director of education. She's also written a couple of textbooks that are used in education throughout the world for massage. So she's absolutely one of the greats of massage education around the world. And she spent time investigating the current situation, investigating COVID, and also looking at the directions that are coming from WHO and CDC and other bodies like that. And really what she's been able to do with that research is create this amazing training. It's got everything you would need to know about how to manage yourself, how to manage your clinic, when you can go back to work, and when you do, what it's going to look like. Things to do with infectious disease control, specifically around COVID. But then also the training includes things like little interactives you can do to make sure that you've learned well, little games you can play and quizzes, so that you can absolutely know that you have absorbed the information, you're going to put it into practice in the right way before you get in to your clinic and actually have clients on the table. So it's a fantastic interview. Absolutely listen to what Anne has to say here. She's just a font of wisdom. And then go and do the training that she's got as well. We've got a link to that in the show notes, and you'll hear Anne talk more about it as we go through. I can't wait for you to hear this. I'm super excited. Here we go. Listen in. Thanks so much for coming on the show today, Anne. Really great to have you on. I know it's an amazing time to be sharing what it is that you're going to share. Really important to be able to dive into some of this stuff that's going on. And I want to just start by asking you for a little bit of a history. You know, how long have you been in the industry? Where do you sit now? People are going to hear your accent. Just give us a little bit of where you're from and what you're doing right now.
So I've been a massage therapist for 23 years, and I began my career in massage in Washington State. And like many people in Washington State, I was a therapist first, and then I became a teacher, and then I became a director of ed at a massage school. And then for me, I made the move to a large international or national organization here in the United States called Associated Bodywork and Massage Professionals. And I've been with ABMP for the last 14 years up until this last August. And they're a wonderful organization. They really let me focus on my passion for education and instructional design and really supporting massage educators in the United States. And then last August, I decided to leave ABMP because I wanted to start this digital textbook project with my husband, Eric Brown, who in the United States has long been a leader really in online learning for massage therapists. So now we have our little digital textbook company that we run from our house. And we're taking some of the material that I've created over the last 23 years and moving it into a new interactive, really exciting format, at least for me. I think it's very creative. It allows us to create these multimedia, very rich environments for content. And as an educator, I know that textbooks often get put off to the side. Nobody reads them. So I wanted to create a textbook that does what a textbook needs to do, but much, much better. And preventing disease transmission in a massage practice was sort of an acceleration of that project, because we had planned to launch in 2021, in February of 2021 with our products, and we moved it up to be able to offer the massage profession this textbook, which we believe will help them as they return to practice after COVID-19.
I think that's a fascinating business story. I love, I mean, we're online trainers as well, essentially, although in a slightly different space. We don't do textbooks so much. But I love the transition that you've got across your business there. And I'm sure it will be fascinating to dive into that side of your business journey and ask a few more questions about that. But really, we're here today to talk about this, the COVID-19 and how to return to work for massage therapists and body workers. And yeah, you've done an amazing job of pulling together a textbook for that. At the moment of recording this, it's still free too, so people can jump in and download that and get some really good information from there. And I wanted to just ask a few questions so that people can get an idea of the kind of thing that you're presenting in that book, and exactly how people can actually get back to work and start feeling safe, maybe even a bit normal as they're returning to work. Now, it is a little bit different depending on when people are listening to this. I know different people around the world are going to either legally be allowed to work or not, different countries, different states, all that kind of stuff. But assuming that this is going to be a resource people will listen to for a few weeks or months, at some point, people are going to get to that stage where it's like, hey, I'm allowed to open my doors, or I'm already open, but I'm a bit worried about the actual COVID-19 thing. How do I keep myself safe, my clients safe? So I guess the very first thing is just to ask a general question. What would you see as the biggest things that people need to think about as they return to work?
I actually think that it's quite sweeping, some of the changes that massage therapists will have to make. And I think that's been the biggest worry for massage therapists here is, as I say in the textbook, we need to supercharge our knowledge, supercharge our policies and procedures, supercharge our sanitation and hygiene, supercharge our use of personal protective equipment. And that's a really big shift for here. So I think why the textbook format works well is we're really able to kind of walk you step by step through that process. Because it's hard once you start talking even about the policies that need to shift. There's all this policy language that we need. There's all of these new documents that we need in terms of legality around informed consent and high risk clients and COVID-19 tracking. So one of the things that I really believe is using kind of a learning format where people learn information in a kind of a safe setting and then start to apply it in real world settings. That's really important. And one of the things that we can do with our platform is I create a number of interactive critical thinking activities, and they can literally, people work through these activities scenarios and they get instant feedback on those activities on whether or not they're doing it correctly according to, for us, the Centers for Disease Control, so the CDC. I know it's probably different for you, but they're getting that feedback in the moment, and that gives them the confidence then to walk into their practices. But I think the big thing here is personal protective equipment and the access to a really good N95 respirator face mask. And I really feel that therapists, because they are at such close contact with clients, need that high level respiratory protection that sort of a mask will give them. And then we have the ethical dilemma of, if we take that mask, are we keeping that out of the hands of a nurse or a doctor who even needs it more than we do? So it's a tough time in America as we contemplate opening up. And people are being, I think, very, I would say they're being very responsible. Therapists are hungry here for knowledge, and they're doing their best to figure out, how do I do this safely? And they're raising these ethical questions and having good conversations. So I've been proud of my profession and how they've approached this incredible dilemma and this huge challenge for everyone around the world.
I totally agree, actually. Now that you say that, you're right. People are asking a lot of questions because they want to do the right thing. You know, they are very
Yeah.
caring of their clients and of the community. And health is a foundation of being a massage therapist or any kind of body worker. So I
Yeah.
guess coming back to that practical side of things, you talk about the N95 face mask for a therapist. Do you feel like a client would need a face mask to attend a session?
Yes. So the recommendation here, and what I do, because I am a massage therapist, so I'm not a doctor. So let's put that all in context, but nobody really knows that much about it, COVID-19. So what I try to do is read all the information from the World Health Organization, from the Centers for Disease Control, the CDC here in the United States, and what they're saying to healthcare providers. And then I'm trying to apply that to the practice of massage and make the best recommendations I can based on the information that's available. So, based on what I believe and what I've read and understand, I absolutely believe that a client and the therapist both need to be in a mask. Now, when the client is prone on the table, there's less need for a mask. Now, they are still producing respiratory droplets, but likely those droplets are falling to the floor. They're not going to like just kind of do this swoop and come up into the airspace of the therapist. That does mean, however, though, that our clothes are getting contaminated with respiratory droplets from a potentially infectious client. And just like with standard precautions here in the United States, where you really make an assumption that everyone has an infectious disease no matter what, you treat everybody as infected and you treat yourself as infected just so that everybody stays as safe as possible. We have to assume that anyone who walks through our doors is an asymptomatic carrier, because the percentage of asymptomatic carriers is around 35% of people who show no symptoms, who have no idea that they're sick, but who can transmit COVID-19 to others.
That's amazing. And so, if you are looking then at clothing potentially contaminated, and I can imagine the actual floor space underneath tables, how do you manage that? Like, do you have extra cleaning or sanitation procedures that go specifically around that?
Yes. So we're recommending right now, and that would be one of the major organizations here in the United States who gives recommendations to state boards, the Federation of State Massage Therapy Boards. Their recommendation, and what I can sort of glean from the CDC and World Health Organization, is therapists should be changing their clothing after every single session. So they should either be putting a protective cloth medical gown over their clothing and maybe rolling up the sleeves or cutting off the sleeves and hemming them, and then having one of those for every single session, or they should literally be changing their clothes. So maybe purchasing multiple sets of scrubs and changing their clothes in between clients to reduce the risk of infection. And one of the things that the CDC tells us is that we want to avoid shaking laundry, and we want to treat laundry carefully. So don't shake out your dirty sheets, don't shake out your clothing. Wrap your dirty sheets and your dirty clothing into a bundle so that most of the contaminated surfaces are on the inside, and put it in a leak-proof trash bag. Because when you're transporting that laundry, it's moving and therefore dispersing respiratory droplets. So we know, I mean, we can speculate, or there is speculation happening, that it really has to do with viral load. And so just inhaling one respiratory droplet with COVID-19 is probably not going to give you an infection. But when the load in your facility hits a certain point, which we don't know what that point is right now, we are at much higher risk of getting an infection. So I think we have to just take every precaution. That's our best bet. That's how we keep everybody safe. And even when it seems a little extreme, I tell people who say that I'm a fearmonger, I say, ugh. I tell them that if in 6 months we look back on this period and say, I probably didn't need to be that cautious, but I'm alive, my grandma's alive, my mom's alive, my dad's alive, I think we're in a good place. So I'm okay with saying, take this seriously and take every single precaution. And oh well, it was a little bit more time that you had to spend to be that cautious, but everybody's safe. So it's all good.
Yeah, that's right. Because it's a big risk, right? It's not a
It
small
is.
thing. And I know we were talking off air just before this, but here in Australia right now, as we're recording, Australia is in a fairly good place. We have flattened the
Yeah.
curve very, very effectively. But with that, it means we're easing some restrictions. And there's a bit of a tendency, not so much among health professionals, but among the general public to just be like, hey, we're over, we're free. And if too much of that happens, it's the same thing. It'll just lead that curve straight back up again because we're not
Yeah.
actually totally free of it yet. It's just that it's not as present so often. We don't have that many cases right now. And it's almost the same thing. It's like there's no downside to being cautious. It just
Yeah.
means that we can maintain what we've got and continue to be safe. Whereas
Yeah.
if we go free too early, we almost have that. We're just introducing more risk, more danger of it getting bigger and spreading even further again. So
And then we'll just all go on lockdown again. Like
yeah,
that will
I
be
know,
what
right?
we'll
So
have to do. So it's like, let's be really cautious now and hope that we can keep that curve nice and flat. And then we can keep living. And hopefully soon there will be a vaccine.
yeah, that's it. Because we don't really know what the future holds. That's the other hard thing about this.
Yeah.
And what you're saying is exactly right. It's much better to get into the future and go, well, we did more than we needed, but we're all safe and happy rather than we didn't do enough because the
Yeah.
downside to that, the risk to that is so much greater. Yeah, okay. So, and some of the stuff you're saying to me, honestly, I'm not a therapist myself, and it does sound extreme, changing my clothes after every session, that kind of stuff. I guess in a practical way, looping around that conversation, when do you see that therapists might be able to lift that level of care and attention? Like, for example, here in our town, we've got zero cases. There's zero cases around us. And so health workers, massage therapists, that kind of thing, theoretically can open and do okay in their businesses, given the restrictions that we're under legally and all that kind of stuff. But where do you see that balance lying?
I think I think we're going to know more in the next few weeks, especially in the U.S. Like, I don't know as much about the situation in Australia, but what we're going to see is we're either going to hear that that a massage therapist was implicated in a contact tracing event where the health department discovered that they potentially exposed 100 clients. We just had this with a hairstylist. And then we're going to be able to see how many of those clients actually get COVID-19. And we're going to be able to talk to that therapist and figure out what they were doing and what they weren't. We're going to continue to gain information. And while it might, I mean, I hear myself say that and I feel cynical, like, oh, we're going to use everybody as an experiment. But that's honestly kind of what we're doing right now is we're feeling our way forward and we're taking every precaution, but they might not work. And then we're going to know more when they don't work. And that's a scary truth, but that's the truth. Now, if I were in Australia in your situation, I might I might not worry so much about my clothes. I might go a little bit different, a different route and say, the likelihood that I'm getting infected is low. I'm going to make sure my client has a mask. I'm going to wear a mask. I'm going to wipe down any frequently touched surfaces with a disinfectant between clients. I'm going to handle my linen carefully, but I'm not going to change my clothes. And I think at that point, that makes a lot of sense to me. If there are very few cases, that's not where the US is at. We're in a situation where there's a huge amount of pressure to open up our areas. And the caseloads in many states are still going up, even when states are lifting restrictions. So we're just not in that same place. We need to be super cautious right now until that caseload drops significantly. But I would say to someone, in fact, I did say this the other day on a different interview. I was talking about a state who I will not name in this interview where their caseload was really low. And I was a little bit flip and said, probably there you could be a little you don't have to be so hardcore about this. You have very few cases. What's the likelihood? Oh my God, the therapist from that state jumped on me, and they were right, because they said, well, we just had a situation where people were being really lax at a spa, and a number of clients caught COVID from a therapist. And I was like, and just one event like that is so bad for our profession. Um, we're already asking people to remove their clothing and get under a sheet and let a stranger touch them. They need to be able to trust that we have cleaned our facility up till it's sparkling, and that we know what we're doing, and we're going to protect their safety at all costs.
Yeah, I absolutely love that. I totally agree. And it is about education. And then also, when a therapist has chosen what they're going to do, them then educating the client as well. Because
Yeah.
I also think it's not that common for clients to come in with their own face masks.
Yeah.
What, and I mean, I'm just going to ask the question, can you have face masks and reuse them for your clients somehow? Or do you need a stockpile of them that you can use? That
Yeah.
seems like a bit extreme as well.
I don't think that is extreme. That might be extreme for Australia, but that's certainly not extreme for the US right now.
I
People need
guess,
to have, well, you can purchase like disposable surgical face masks,
oh
one time
yeah,
use,
okay. Yeah.
and those are fairly inexpensive. You can get big boxes of them. It's the N95 respirators that are much harder to come by. But here's the thing about the respirators, and this checks out with the CDC. So this is not just Anne, this is the CDC. You can recycle your N95 respirator mask. They're pretty sturdy if you've ever worn one. So what you do is you get 2 of them. And then when you take off your mask, you take it off correctly. You don't like touch the surface. You put it right into a paper sack. You seal up the paper sack and you put it on a shelf where it's going to get a lot of air circulation. And you do that for 24 hours. And the next day you wear your second N95 mask. And then you take that one off. And then you take the one down from the shelf, and that's the one you wear. So you just recycle them every other day, and they last quite a long time. So if I were a therapist, I'd wear an N95 myself, and then and I am a therapist, and then I would have my clients wear a surgical mask. And the cone shaped ones are great because they fit a little bit tighter to the skin of the client. They're very comfortable to wear. They're easy to breathe in, but they will give the therapist more protection from clients who are exhaling in the session room. And that's the other thing. If you've got a window, open up your windows after every session, run fans, circulate the air. And that's what the experts say is the very best way to dissipate COVID-19 droplets that are hanging in the air. And if you have an enclosed space where you can't open windows, get a portable HEPA air filter. And I should just be clear, these have not been tested on COVID-19 yet, but they were used very successfully with SARS in SARS isolation wards. And we know that's a similar virus in terms of how it operates.
Yeah, fantastic. That's all really good advice. Because I guess that's what I was thinking. If the N95 masks are hard to come by, and we want to make sure that at the moment anyway, the frontline health workers have access to them, I don't really want to buy like 20 a week to give to my clients. You know,
No.
it's just a bit of a waste of masks as well as
Yeah.
that. But surgical masks are much easier.
Yeah.
And yeah, being able to reuse them for yourself is great as well. What about like one of the things that will happen or is happening already is that the therapists are controlling a little bit more carefully who comes into their clinic. And it is always one of the intake form questions is it, how are you feeling? Have you been sick and all that kind of stuff? And now we've got overseas or interstate travel being part of that. But how do you actually make sure that your clients are healthy enough, A, to receive a massage, but also to not be spreading COVID? If 35% of cases are asymptomatic, what's the practical things we can actually do?
So the first thing we can do is make clients really aware about underlying conditions. And the CDC has clarified what conditions lead to serious cases. So if you have heart disease, high blood pressure, diabetes type 1 or 2, being a body mass index of 40 or higher, so severe obesity, if you have chronic liver conditions, chronic kidney diseases, if you've got suppressed immunity, whether that's because of something like leukemia or HIV/AIDS, or because you're on a medication that suppresses your immunity, if you've got respiratory issues like eczema, not eczema, emphysema is what I'm thinking about. So far, I haven't heard that eczema is an underlying condition for COVID-19. Or if you have bronchitis or even moderate to severe asthma, you're at much higher risk. And when we say higher risk, we mean you are much more likely to end up in the hospital, on a ventilator, or dying. So I would say high-risk clients, and I should add anyone 65 years or older, regardless of how healthy they are, I would say no high-risk clients in the United States right now to the United States practitioners. And you guys might be able to fudge that a little because your caseload is so low. So that would be one thing, is just high-risk clients, not a good time. And then the other thing is, we're recommending that while there's still quite a high level of COVID-19 in the population, that you are greeting clients at the door, you're using a no-touch thermal temperature taker and scanning their temperature. You're making sure before they enter your facility that they have a functional face mask, whether their own or you're handing them one, a disposable one, and you're asking them to decontaminate their hands with an alcohol-based hand sanitizer. And then you're walking them straight back to the session room. So you're really just controlling how much time people are in your space and how many people are in your space at once.
Yeah, I think that sounds great. And I'm also imagining that for a lot of people, pre all this happening, there is cleaning procedures and there's sanitization. There's always been that. Massage
Yes.
therapists are pretty aware of that kind of thing. But I also know that there would be some therapists that are very strict on that, and some that just, play it a bit more loosely before all this happened. And so I
Yeah.
can imagine even now there will be therapists still, maybe the entire range is moving a bit more seriously, but there'll still be some that take it more seriously than others. And even in the
Yeah.
US, as you do see lower cases, it's going to be more like we are already. There'll be people who are like, hey, it's safe enough now. And there'll be other people who are like, no, it's not. And it's a very divisive kind of thing, or that's what we're seeing at the moment. I guess what I see is the actual procedures around that is part of the way that an individual therapist protects their own health and their client's health, but also how they can kind of legally or ethically back up the decisions that they're making. It's like, this is my cleaning procedure. This is what I do in between each
Yes.
client. I'm allowing an
Yeah.
extra amount of time, et cetera, et cetera. And I also know from experience, not every therapist is great at or willing to write lots of procedures down and actually write down what's going on. How important do you see that side of things, the kind of tracking and recording of procedures and what people are doing?
Well, one of the things we just produced as sort of ancillary materials to the textbook that I think will really help people a lot is the textbook really gives them this foundation in all of the things we're talking about, in everything you should really know about disease prevention to be a truly knowledgeable professional and to run your clinic at the highest level of sanitation and hygiene. And like you said, people find a different, they're on different aspects of that spectrum. But one of the things that we just did is we created 4 training videos that are less than 30 minutes each. And they really walk people through, this is what you're going to do for this, and this is what you're going to do for that. And we just posted them today. So they're really brand new. But for the American therapists, I also posted policy documents so they don't have to figure out their own policies and procedural language. They can literally download a document and send it as part of their health forms and get all of those sign-offs from their clients that are part of informed consent, understanding if you're high risk, understanding that the health department will follow up with you if there's been some sort of COVID-19 outbreak. All of those pieces, because there's no way you can sort of just say, I have this all memorized. It takes a lot of work. I mean, I've been like putting this textbook together and I still go, what are the procedures we need? So it's all written down and I've tried to take it a little bit out of the textbook. I want people to read the textbook because I want them to have everything, as you do as a writer. You need everything. The truth is the highlight reel video is very helpful. So if you don't want to read the whole textbook, you can just watch the highlights or download all of the forms and policies and procedures so that you have that readily at hand. And you can either adapt that to fit who you are and what you're willing to do, or you can just use it as it is.
It sounds fantastic. Thank you so much for making that resource available. It's really helpful to the entire community to have that sort of stuff there from someone who has looked into it and studied it so well. So thank you. That's really great.
Yeah,
If
I'm happy to do it.
we've mentioned this a couple of times, and I really love the idea of the textbook that you're mentioning, because it's not just literally a written textbook. It sounds like it's quite interactive and helps people learn in a few different ways, plus the policy documents and all that kind of stuff with it. We've mentioned it a few times. Where do people get this? Where can we go to actually download this? At the moment, it's free, right?
And it will continue to be free. Um, not not everything on the website will be free. I have to pay for my midlife crisis, my little orange midlife crisis, which is a Jeep. So I got to make some money at some point. But for right now, this is free. And you can go to massagemastery.online. And if you just kind of scroll a little bit down off the pretty opening picture, it says digital textbooks. And we've put preventing disease transmission right at the very top. And you just click the access for free and you have to fill in a form. It's just the way that our registration system works. But it won't ask for your credit card details. You fill in the form and you'll have immediate access to the digital book. This is not a printed product. We will not mail it to you. You literally have to have an internet connection to access it, but it does go mobile. It's very nice on a phone and on a tablet, and really great on a big laptop computer too. But I use a very specific instructional design methodology for how I deliver content. And people really find that useful. We look at the terminology first, and then we sort of move into the content. And at the end, we start to apply it with some learning games. And then we check our knowledge with the quiz. So
Sounds
it's
fantastic.
fun. And it's very visual. Because it's digital, I don't have to worry about printed pages and the cost of beautiful color photographs. So it has tons of visuals. And then when I'm talking about a document, instead of having to go find it somewhere, you just download it right there and then. And then I can also do things like I update the information on COVID-19 every single week, because new information comes out all the time. In fact, I have a number of updates I need to do tomorrow. But no matter what version of the textbook you have, it's updating in real time. So you'll see it the next time you go. You'll go, wait, that client education poster wasn't there before. That's new. And it's like, yes, it is. It's like a new toy every time. So for me, that has been an incredible joy, is just to be able to build off of something. And it becomes a little bit more like software, because you have sort of a launch and it's 1.0, and then 2 weeks later I can do a 2.0 if I want to, and I can just continue to improve what that product looks like. And as you get user feedback, you know this as a businessman, when someone starts to respond to your work, when it's out there living in the world and people start to engage with it, they will point out very quickly every single thing that's wrong with it. With a printed book, I'm 5 years away from fixing that. But with a digital book, I'm 5 minutes away from fixing that. So for me, as an author and sort of as a creative person, it has been a dream come true to kind of create this product and then see the possibilities for other products in the future.
I love that. I love how excited you are about the
I
actual
am
delivery
excited.
and the format. It's really, really cool. That's great. And again, I can't wait. Maybe we'll have another interview at some point in the future where we can talk more about the actual journey of creating that sort of stuff. But
Yeah.
for now, I just want to say again, thank you so much for sharing in this interview and also the amazing resource that you've put together for the entire community around the world. We'll definitely have the links to download that in the show notes. So if you're watching this, just go below and you'll find that to be able to click through. And yeah, thanks again. And I can't wait to see all this over, however long that takes.
Thank you so much for having me and for inviting me to Australia. That was wonderful fun, and the flight was no problem.
Yes, maybe next time we'll meet in the flesh. We'll
That would be great.
you can ride a
All right.
kangaroo while you're over here.
Yeah, I would love that. All right. Thank you so much.
No worries.